right, today is May 11th. I have Holly in my office this morning. Holly, I was wondering if you could just share with us what you first came to the office for.
Well, basically, it was probably my last hope. I've suffered from Parkinson's, and I had a terrible time with depression, and I was referred to your clinic by, I guess, some research online from a friend, and in trying to better my body, which will also help heal my brain. And so basically I was probably 0 when I came into the clinic.
Okay. Well, how would you rate yourself now if you were a 0 when you came in? If 100 being perfect ideal, exactly how you want to be, where would you put yourself today?
Well, I'd probably have to separate it in 2 categories. One being the Parkinson's, which seems to be under control. The other one was depression, which was terribly, terribly low, but I'd say probably now I haven't suffered from depression for probably about a month and a half.
Awesome.
And my psychiatrist is going to suggest me weaning off of my pills for depression to see if I can quit taking them.
Awesome, awesome. Now, we went through a very extensive workup with you with blood, saliva, urine. You went through an aggressive detox program. You did great. You were very, very compliant. How did that detox program go for you?
Well, not what I expected. I thought it was kind of compared to childbirth, and they tell you it's going to be a little discomforting. I was sick. I mean, I'll be honest, I was sick for 7 days, if not even longer, before I started feeling good. But I couldn't get out of bed. I mean, I felt like if this was the end of the world, it had to get better. And finally, it did start getting better. But it was very intense, and it's not for the weak-minded people.
Oh,
definitely, for sure.
And then after that week of boot camp, you also went through a modified elimination diet where you, for 30 days, avoided foods. Now, you told me something interesting today. I wonder if you would share with patients what foods you were found sensitive to. This is basically you eliminated foods from your diet for 30 days, started to add them back in slowly, and then what were your findings?
I'm really not that sensitive to a lot of foods that I was, concerned about. Prepackaged foods, I definitely am very highly sensitive to. I can't eat them without having some kind of side effect within an hour. Peanut butter, I guess I'm going to have to say goodbye to. Peanuts, I guess that's kind of, a lot of normal people have those kind of sensitivities.
Sure.
Anything that was like, say, fast food, I can't eat, but for the most part, I can eat everything else. I can still eat beef and pork and all vegetables that I know of so far, and fruits, fruit juices and vegetable juices. It really hasn't limited me. It's the pre-processed, pre-packaged stuff that I cannot have.
Excellent, excellent. And I know that if you want to share this, have you seen any other providers, maybe outside the state at all, for your condition?
Yes.
Do you want to elaborate on that at all?
I've only seen the provider for my Parkinson's condition, and they have still, said that my Parkinson's has not really progressed at all. But still, I did tell them about what I'm going through with Dr. Sekchuk, and she was really interested, actually. She wanted me to email her all the stuff that I'm doing, and so that she's on top of it too. But out of all the list of the supplements I'm taking, she's only heard of 2, and that was St. John's wort and, of course, vitamin D. She had no clue what any of the other stuff was for, and that kind of concerned me that she wasn't as knowledgeable as you are, as far as with your body and keeping it in tip-top shape, because Parkinson's is something that's going to, over time, take control. So you'd think that they would learn more about the health side of it also. Sure.
And I was very impressed. So this was a male clinician, and she did put in her note that she sent to my office that although she didn't understand the program you were on, she did actually encourage you to continue and was looking forward to seeing you how you would progress. So I thought that was very encouraging to have a male clinician say that. So, well, Holly, you are a model patient. Thank you for doing this for us. Do I have your permission to share this with doctors, students, patients, and post it onto our website?
Absolutely.
All right. Thank you so much. Keep up the good work. And do you have any parting words of advice to any patients out there that might be going through a difficult time, trying to throw in the towel, saying it's just a long journey, it's too hard? Do you have any words of advice for them?
It is a long journey, but I had a long journey before I met you. And now it's the journey's better, a lot better. And just, you can't be afraid. You have to try. You can't quit. You just can't, because there is something out there that you finally, eventually might find that will help you, or at least help you to a point where you're going to feel a lot better than you did before.
Awesome. Thank you so much.
You're welcome.